welcome. It is Thursday of Health Professions Week, and at the Montgomery County ESC, we are very excited to continue offering some additional information for all of you interested in health professions. Just as a quick review, if you haven't been able to join us live for all of our events, we do have pre-recorded videos available on the website DaytonRegionalSTEM Center.org/HPW for our Health Professions Week, where you can access any of the previous videos, as well as many exciting hands-on activities that you can explore different careers in the health professions. If you have been with us this week and you've been able to learn about many different professions in healthcare and health sciences, you realize there's a wide variety of professions. And while there's a lot of different things that you can be focusing on, they all do have one thing in common, which is being specialized professions. They require some sort of focused training or certification. So we are very excited to have Sinclair Community College as an amazing resource in the Dayton region, which provides 58 different programs or certifications in the health sciences. So joining me today, we will have two representatives from Sinclair's Health Sciences Department to take us through some information about their different programs and how you can learn more about getting on one of these health professions pathways. Just as a reminder, if you're watching this live, please feel free to use the chat feature to ask any questions of either of our two presenters during this session, and we will try to fit in as many of those questions as possible. But without further ado, I would like to introduce our first speaker, who is Dr. Rena Shuchat, and she is the Dean of the Health Sciences Division at Sinclair Community College. She joined Sinclair's faculty originally as an assistant professor, and then eventually a professor in the Dental Health Sciences Department, where she eventually became the chair of the department. In 2011, she became the dean of the entire Health Sciences Division, which houses 58 degree and certificate programs, reports to 20 different accreditors, and proudly partners with countless healthcare organizations in our region. Dr. Shuchat holds a Bachelor of Science and Master of Science from The Ohio State University, and a doctorate in Community College Leadership and Administration from Capella University. Rena is very proud of the 20 degree and 38 certificate programs in the Division of Health Sciences, the 1,000 students who complete these degrees and certificates annually, and the 88% or higher employment rate of the graduates, and the over 500 clinical affiliations that her students participate within the region. So please welcome me and in welcoming Dr. Rena Shuchat to tell us more about these amazing offerings at Sinclair Community College in the Health Sciences Division. Thank you for being here today.
Well, thank you for having me. And we are excited always at Sinclair to speak with high school students, especially those interested in healthcare. I know from personal experience at a very young age, I knew exactly what I wanted to do, and it was healthcare. And I have no regrets, let me say that. But interestingly, I didn't really know all of the different healthcare professions that were out there. I knew the ones I personally had experienced, and thankfully, I didn't have a lot of healthcare issues in my family, so it was the traditional. I knew of a nurse, I knew of a dental hygienist, but I didn't know of a respiratory therapist. I didn't know of a radiation technologist, occupational therapy. I didn't even understand occupational therapy versus physical therapy until I was at Ohio State in college. So I think this is a really important time to be talking to our students. As well, the reason it's important is because we have so many more healthcare certificates now. And I'm going to elaborate on those, but for the first time with having these certificates as pathways, students can earn and learn at the same time. And we know with the cost of higher education, it's really important for students to be out there earning an income as soon as possible, and sometimes having their own health insurance as soon as possible. So I have with me my colleague, Jenny Bagwell, who is an academic advising manager. And I am going to speak to our division and what we offer. And then she really understands the pathway of how to get there, where your first steps are. And so I think we'll have a lot of your questions answered, but we'll always be willing to take more. So Jenny, if we want to get started with the presentation, she's graciously going to flip slides for me, so you'll hear me saying that each time. Go ahead and move forward there, Jenny. Let's see if we can get to that. There we go. Our mission in health sciences at Sinclair is that we not only want to educate students for the communities we serve, but we want them to be compassionate healthcare professionals. We want them to know the latest and greatest of technology. We want them to have a wellness approach, which is more preventative. And we use evidence-based practice and interprofessional initiatives. And you'll hear me talk about interprofessional education. That's newer, but it's something when you're shopping colleges for healthcare programs, knowing that they participate in interprofessional initiatives is very important, and we'll highlight some of those throughout this presentation. Next slide. Some interesting facts about Sinclair's Health Sciences Division that really most people in the community do not know. We have a lot of students in healthcare. Jenny and I have great job security, thankfully at Sinclair with that. We know we have on average about 25,000 students that attend Sinclair, and about a third of the students are interested in some kind of healthcare. Not all of the students continue on a healthcare pathway because they get experiences with things they never knew about once they come to college, but we do know about a third of the students have an interest in healthcare. We have to update this slide because that last certificate was just approved recently, but we do have 58 degree and certificate programs that many people aren't aware of, and we'll show you those. We report to 20 different accrediting bodies within my division alone. What does that mean for you as a student when you're shopping these healthcare programs? You have confirmation that external people have come in and reviewed Sinclair's healthcare program, and they say we either meet or exceed the expectations that they have for a healthcare program. And that is vitally important. We'll talk about that too. Lots of students in the pipeline. So we have rumors all the time that we have nothing but wait lists and it's hard to get into the programs. And we can tell you that's not true in all cases or most cases. And then we do have 12 different departments that house these 58 degree and certificate programs. And then today I'm really going to highlight our beautiful Health Sciences Center that we opened in 2017, a $32 million building that was dedicated to healthcare and our healthcare professions. And I can tell you not all community colleges can say they have such of this, and not even all university programs can say this. The technology and the labs we have are very similar to what you'll see in high-end, state-of-the-art medical schools. So we are really proud that Sinclair puts a lot of money and effort into our programs. Next slide. So you can't possibly have all of this and read it all and take notes on this, but we did send over this information that can be distributed through your teachers and through your schools. We have on the left all the different associate degree programs. These are 2-year programs, typically 4 or 5 semesters to complete. And on the right, we have our certificate programs that many people do not know about. There are a few programs that have asterisks beside them that we call our postgraduate certificates, meaning you already have to have one of the associate degrees on the left to get the additional credentials, but those are very few. What we have is dietary manager for people who are interested in the nutrition area and dietetics. We have nurse aide. We have paramedic, which is actually a certificate program, not a full, it doesn't have to be a full degree program. We have home health aide, which would be an STNA program with an additional certificate that would allow you to work in a home health care setting without having previous experience behind you. Patient care technician, which would allow you to go straight from being an STNA into our patient care technician, 3 credit hours, and you are eligible to work in the hospitals. So those are the kinds of things that we're doing. What I will tell you is not one of these degrees or certificates was created without employers coming to us and telling us there is a need. We don't make up these degrees and certificates for no reason, which is why we can proudly say our students have an 88% or higher placement into jobs. Next slide. So why would you even choose a certificate program? Because you know you want a certain degree program. Well, some of our degree programs do have a little bit of wait time. Even if they don't have a wait time to get into the program, they typically still have a prerequisites that you have to meet before you're eligible to come into the program. Students can complete a certificate program in as little as 4 weeks to 2 semesters, traditionally part-time. So even if you have a job in the fast food industry, you could still hold that job while earning your certificate. Once you get your certificate, many of our certificates lead to a third-party credential, which gives you a title to be able to go out and work in industry. Most of them have full-time employment opportunities. And what that means is you have the opportunity for healthcare benefits. Many people, young people nowadays, can stay on their parents' health insurance for some time, but that's not the case for everybody. And so having healthcare insurance is sometimes vitally important. And then what I think is really cool about our healthcare organizations and our hospital networks is they have fabulous tuition assistance programs. So if they've hired you to be a patient care technician and they know you're interested in going back for nursing, they have tuition options to help support you. So it's possible you might not even have to fund fully your degree program if you follow a certificate to degree pathway. So we call it our earn and learn approach. Next slide.
Dr. Shuchat, could I ask a quick question?
Yes.
You mentioned some prerequisites. Would those be prerequisites that they would be taking at Sinclair or possibly through College Credit Plus at their high school?
It could be a little bit of both, and I'm going to let Jenny be the expert on talking about those prerequisites. But depending on the program, we do have some CCP offerings.
Thank you.
I do want to highlight, because this is a brand new to Sinclair, and so as soon as I can tout this with anybody, I really want our schools to know about this. We have a dire need in our region for medical assistants. Medical assistants and nurses are not the same profession. They are both credentialed individuals, but they work in very different settings. Medical assistants are typically working in physicians' offices where nurses may be, but nurses are also in hospital settings and long-term care facilities. Medical assistants are supporting the physician's office and supporting the physician. We have always at Sinclair had a degree program in medical assisting, meaning it took you 2 years to complete, become credentialed, and be able to go to work. We have since changed our pathway to medical assisting because employers are begging us to get more medical assistants into the region. So if you think you have any interest in working in a physician's office, I urge you to really talk to Sinclair advisors about the medical assistant certificate program. What is it? It's a 1-year certificate program where you will, after 1 year, be credentialed to be a medical assistant and go to work. At that point, 1 year later, 2 semesters, you could choose to stop your education if you're satisfied with that and continue working. Or you can choose to continue immediately and seamlessly into the degree program. Or perhaps you work for a while and 2 years later, you want to come back and complete your medical assisting degree. If you add on the degree in medical assisting, you are only adding 1 year because they take the entire 1 year certificate as part of your 2 years of that degree. No wasted credit hours, not one. In addition, when you complete the degree, not only are you proud that you have an associate's degree that can lead to management opportunities in your physician's office, you will have 3 additional certificate credentials in patient access and scheduling, medical scribe, and reimbursement analyst. And what that does is make you a more valuable employee and likely going to be able to go up in pay because there's more things you're able to do. So we are really proud of this. And I can tell you, our region needs medical assistants, and this is something I would urge you to talk to advisors about if you have any interest. Next slide. So why are we so innovative in education? Go ahead and go to the next slide. I'm going to go to some photos because I think that's what students like to see. These are photos from Sinclair. We are all about state-of-the-art instruction. This is a nursing lab taking place that is a patient simulator in the bed, not a real patient. But our human patient simulators that we have, they are so real, it's unbelievable. Some of them blink. They can do pulse respirations. They have veins. So when you're learning to do IVs, you actually go into what looks like a vein and feels like a vein. We have different skin colors for that because the patients, depending on your pigmentation, your veins are different to access. So it's important that we provide students with all of those experiences in the lab setting. But what's really cool about our state-of-the-art instruction is the teacher is right there. We're at the patient, which is the simulator. We're talking about it, we're doing, and then we're going right back to talking about it in small groups. So students are constantly learning. Next slide. This is our sim mom, and we're really proud at Sinclair to have a sim mom because not everybody can say they have this. This is a birthing simulator. And so sim mom is pregnant, and sim mom has a baby inside of her. And behind that window that you see behind her head is where faculty can be simulating noises the patient might be making. They are altering the patient's blood pressure, pulse, respirations. We throw our students into a situation that they have been educated on and see how they respond. Sometimes the students go in and it's a perfect birth. And sometimes things go really wrong, just like it really does happen. The baby is birthed. Sometimes something is wrong with the mom and baby. Sometimes maybe something just with the mom. But we also have the incubator right there in the room. And I'll tell you, when I talk to you about interprofessional education, this is where we see some really cool experiences. We bring now our nursing and respiratory therapy students together into simulations in this room. And when we first did this in 2017, and that was the first time we did it, we had a bad birthing experience and something went wrong with mom and baby. And do you know what happened? The nurses got in the way of the respiratory therapy students and the baby died. It was all real scenario of what would have happened in the room. And those students take it really, really hard, but it happened and we got to learn from it that nurses and respiratory therapists, it is vital that they understand the roles that each one of them have in patient care in that room so mistakes don't happen. Why do we do this and why do we let students make mistakes? Because the research shows that if a student in simulation learns something, even if it's a mistake, it is likely to never happen again in the real world. That's why we do this. Next slide, please. This is respiratory care students, respiratory therapists. So it's just a different lab. They have their own lab, and then we have shared lab spaces as well so we can do the interprofessional. Next slide. Oh, our surgical center. So we have an actual operating room at Sinclair. We have a surgical tech program. I would say one of the degree programs people don't know about. In that department, we also have 2 certificates, one called sterile processing. And those are people at hospitals behind the scenes who are sterilizing all the instruments so they're ready to go for an OR. Most students don't know we have these. This operating room is exactly a replication of what you will see if you go into any Premier Health facilities operating room. And why do we know that? Because when we were building this, we asked our partner Premier, what should it look like? And they gave us their inventory. And we literally bought what they have. So this is a really, really cool thing. Next slide. EMS, which is EMT. I know some of you had questions about EMT, but it's EMT paramedic. These are certificate programs that can lead to a degree, but you don't have to finish the degree. And Jenny can talk to you about that if you have questions. But this is our EMS lab, and this is the true back of an ambulance. And inside this ambulance is 4 cameras. And we will put students with the simulator into the ambulance and close the doors. The cameras light up in the classroom and students can watch each other and what they're doing and learn from what they're doing right and what they're doing wrong. Why we've added an entire ambulance to this building, we surveyed our students when we were building this and designing this building. We surveyed our graduates and said, do you feel like the education you received at Sinclair was adequate? And overwhelmingly, what we heard from our paramedic graduates was, I felt completely ready to go. I'm good at my job. You did everything right. The only thing that was difficult for me is I wasn't ready for the confines of an ambulance. We did everything in big rooms. So we said, well, if we're going to do it right, we're going to put an ambulance. So this is truly the back of an ambulance we purchased without the truck engine part, sitting in the EMS lab. Next slide. That just shows you with the door closed and the lights on. They don't have perfect lighting. And so they're having to figure out all the different things they're doing while they're driving, shifting around, and all the noise and congestion that comes with that. So next slide. This is Rad Tech's lab. So if you're interested in radiation technology, they truly have their own lab space connected to their classroom. So through that window, you can see their classroom where they might have some lecturing. All of those TV screens along the wall that actually go all the way around the wall light up all the images that they take so they can talk about them and learn from them right there. We obviously have fake bones because we can't keep radiating each other. But this is true radiation equipment that students have to perform safely with because it's active equipment. We're just using fake bones to do it. Next slide. This is medical assisting. This is our simulated physician's office. We have 3 rooms next to each other. It truly feels like you've walked into one of your doctor's offices and they tell you to either go to room 1, 2, or 3. And when you walk in there, there's cameras there, but to be able to record things, but it truly looks like the physician's office down to a sink. We have an area where you can do specimen passing, just like in a physician's office, everything you would do. Next slide. And this is our dental hygiene clinic. If you are unfamiliar with Sinclair's Dental Hygiene Clinic, we see patients from the community at $10. This is a service we provide back to anyone in the community who would like to have their teeth cleaned or any of the procedures a dental hygienist is licensed to do. We also do Give Kids a Smile Day, which is a national day where we provide dental care to Head Start children. And this is an example of that day. But we have 25 dental chairs in our clinic, and we see patients on Mondays, Wednesdays, and Fridays. The value of the services we provide to the clinic are about $500,000 a year in dental services to the community that we do not charge, obviously, all that for. So a great service, and our students have their own clinic right at Sinclair. Next slide. Veterinary Tech. All high school students love the idea of working with animals. But what we will always tell you is don't forget the bad part that comes with animals. You know, animals die, animals are hurt, animals are abused. And so we see it all and our students see it all. But we do have a beautiful vet lab that's in building 9 next door to our Health Sciences Center. And then our students go out to all different clinical sites. So they have experiences with large animals, domestic animals, birds, you name it, they get those experiences. And so Vet Tech is a very popular program. Next slide. So why are you going to choose Sinclair? Well, I'm going to tell you why I think you should choose Sinclair. But whether you go to Sinclair or you go to a university or you choose another community college or you look at private schools, I want you to be armed with this information because this is what you have to be asking and checking into. Next slide. Clinical affiliations. We have over 500 clinical affiliations Sinclair has. What does that mean? We have employers who have signed contracts that they want to work with our students while they're in the program, while they're students, to give them their clinical hours. Not all programs can say that. There are programs that will tell you they don't have a waiting list. They don't have a waiting list for you to go through lecture and lab, but you will wait on a waiting list to be allowed to come into a clinical. Not at Sinclair. It is integrated into our program, and we assure that if you stay on your pathway, you will complete in the time, the 2 years from when you were admitted into the program. Next slide. Licensure rates. This is public information, and if a school does not provide you this, you should be concerned. You want to know that if I'm going to invest in this program, time and money, I am likely to not only graduate and get my diploma, I'm likely to pass the licensing and credentialing exam that allows me to have the job. Your diploma means nothing if you cannot pass the credentialing exam. So you can graduate from Sinclair and have a nursing degree, but if you can't pass the NCLEX, you will never work as a nurse. These are our pass rates on those exams, and you should ask this question of any school you look at. Next slide. Employment and university transfer. We have, I told you, an 88% or higher employment rate. Why in some programs is it only 88%? Because many student graduates choose to go straight into a bachelor's degree program and not go to work right away. So some of our lower rates down in the 80s are because students opt to not go to work and focus on their bachelor's degree. But we have employment, we know. They ask us for more of all of you. So we also know we have great university transfer partners. We have agreements with schools all over. We have some, and Jenny is an expert on this, we have some that is seamless 2+2. You add on 2 more and you'll have your bachelor's degree. We have others where it might be 2.5, but we still get you there. So again, we have great transfer with universities if you want to go into a bachelor's degree. Next slide. And earnings. I mean, we know healthcare, you earn a lot of money, eventually more and more, and we are thankful for our income, well-deserved income. We know of our graduates, when they walk in the door at Sinclair, their median annual pay they're making is about $17,500 a year. If they complete one of our health sciences certificate programs, within 1 year of completing, their median income is $28,700. If you complete one of our degree programs within 1 year, you'll start at $48,000. That doesn't even account for right now nurses and respiratory therapists that are making $65,000 to $90,000 a year. So this, it has dramatics, ebbs and flows, but this shows you we will get you to a respectful income with one of our degrees or certificates. The next slide. This is our contact information. I will, and Jenny will say the same thing. If you are brand new to Sinclair, academic advising is who you should talk to first before you try to call us. But in the meantime, while you want to look at all of our degrees and certificates, everything about them is posted on our website. And I would encourage you to go to those and just surf around and see and shop and find out about new degrees and programs. Then when you schedule with academic advisors, they can provide you with some really good insight on how to be on that pathway. So I think that ends my portion. Is that right, Jenny? And I'm happy to take questions, but I will say I want to hold off on enrollment questions, advising questions for Jenny's portion. But if you just have questions about our programs, I'm happy to continue with those questions.
Well, I'll wait and see if anything comes in through the chat, but I was very struck by the slide that was shared about the increase in earnings from the 1-year certificate to the 2-year associates. And I think one point that I would like to say that I don't know the answer to, but I think is true, is that the students aren't going to be losing those earnings to tuition, because Sinclair is also extremely affordable for students in the area. And so it's not like going to a private university where, yes, you're going to make more, but you just paid all of that out in tuition.
That is correct. And we have on our different program websites, we are very transparent with the cost of our programs. Healthcare programs do have additional supplies and uniforms and things like that that students have to purchase, but that's all out there. Typically, a Sinclair student's paying about $3,000 a year in tuition, and then they have some more in supplies when you're in healthcare. But you're right, it's extremely affordable.
Great. And also, I was very struck as you spoke about the amount of hands-on learning that the students are doing. And when we looked at that slide of the X-ray technician program, I was very struck also, there's that blend of classroom learning and hands-on learning. Would you say, I mean, I know it's going to change program by program, but is there kind of a general split of classroom to hands-on?
Yeah, we actually have, every program has lectures. You got to have lectures. When we built the Health Sciences Center, I will say almost every one of our programs has a connected classroom and lab, or they're integrated into one space. Nursing, for example, has all of their simulation beds around their classroom. They lecture in the middle and go to the lab, because we're big about lecture, go do, come back, let's talk about it. So you're not going to sit through hours and hours of lecture before you can ever get your hands on anything. So, and yes, I would say we are easily 50-50, if not actually heavier with the hands-on.
Okay. And the last question I want to ask is one that was submitted from Rosenda, who's an 11th grader at Dunbar. And she is a native Spanish speaker. And so she was interested in what supports would be available for anyone interested in entering into any of the programs, which again, you could speak to, more widely to any sort of accommodations or diversity that you are able to support with your programs.
I'm going to hand that one to Jenny, but I will say we have many students who come through our programs where English is not their first primary language. Is it sometimes more challenging for those students? Absolutely. Is there support at the college? Absolutely. But it is challenging to not have it as your first language, and then in addition, have really difficult medical terminology added on. But is it doable? It absolutely is. Jenny, I don't know if you can add to the ESL support.
We do have international education that also have programs as English as a second language. But in addition to that, I have conversations often in the beginning of meetings, and I jokingly ask students, what is the subject you wish you never had to take again? And then that helps me identify maybe that student might be open to doing our tutoring and learning services. And we do have a very extensive writing lab. So even if it's a person that has English as their first language, they might have difficulty in that area. So we do provide that information to students right away, which I'll touch on in my part of the presentation.
I think too, the other thing I would encourage, I think you said her name is Rosetta, or any student who does not have English as a primary language, get started in our introductory course, which is in allied health. You'll get the touch of what you have coming with medical terminology to make sure you think you're ready to work on it that hard. But it's not wasted credit if you choose any of our healthcare programs, because it's a requirement of all the degrees. So it's a way to kind of get your toes wet without being totally absorbed in something. So if you realize, I don't think I want to work this hard, or I don't think this is for me, you can easily pull back up without too much wasted credit.
Mm-hmm. Thank you so much. That is wonderful advice. And I hope a lot of students hear that and take you up on that suggestion. I think it's a great time to transition to hearing from Jenny Bagwell, who's an academic advising manager with the Academic Advising Center at Sinclair Community College. Jenny started at Sinclair as an academic advisor and is now an academic advising manager, and oversees the health science academic advising on the main campus in Dayton. She leads a team of 13 academic advisors and coaches who help over 1,000 student appointments in the last year. She earned her bachelor's degree from Lafayette College and Master's of Science at East Stroudsburg University. And prior to tenure at Sinclair, was an assistant director of NCAA eligibility and student success at Ohio University. So in addition to Dr. Shuchat, she also works with the Health Sciences Department and is passionate about helping students on their academic journey and is dedicated to student development. So Jenny, we would love to hear from you about, now that everyone's so excited about all the programs that you offer at Sinclair, how do they get on one of these pathways, and how can they find out what is right for them at Sinclair?
So I would say that, in the beginning, I didn't know what I wanted to do to get to this position. And I realized that sometimes when you can't do, for me, I don't want to do patient care, but I want to get people into patient care and advise people in order to get from A to Z. So honestly, I think this starts with a conversation between advisors and a student, and also just some soul searching to kind of figure out where do you want to be after your high school career. So I'm going to jump in here a little bit with the presentation, and some of those questions I'll be able to answer as we go through this. So the beginning stage is, what is academic advising? Let me tell you, I always want students to talk about themselves when they come and meet me, because that gets me to know who you are as a person, what your goals are, what's your timeline, what you know, and then also tells me what you may not be aware of. So I first want to kind of unpack what is academic advising, because I get a question all the time from my colleagues asking, what do you actually do in your day-to-day? And I'm like, my days are always so different. So academic advising is truly a partnership between an academic advisor and a student during their academic career path at Sinclair. And we want to basically inform students about the information that they have, whether it's about curriculum, the program admissions requirements, what type of profession do you want to do and where do you see yourself after? Is it transfer? Is it an actual career right after? We have those conversations at the beginning because we want to make sure that the student understands we want them to make informed decisions throughout their entire time at Sinclair. And especially in the beginning, there's just a lot of steps to complete, and that can be intimidating for students. But we're not just throwing you to the wolves, we're going to help you, guide you during the entire process from start to finish. And once a student actually decides on if they are going to be in a specific career community, so health sciences is its own individual community. If you did think in your head, I would like to maybe look into medical assisting, or I'm interested in paramedic or dietary manager, you then get matched up and assigned to with an academic advisor throughout your entire career unless you change career communities, which is really nice because you not just have a rolling group of people to talk to, you actually have a person that has known you from the time that you started at Sinclair. So some of the top 5 reasons that to come and see academic advising, I wanted to list to students, why would I actually come to my academic advisor even after I had my initial meeting? There's all variety of type of students. Some students know exactly what they want. Dr. Shuchat, sounds like that's what you were. You wanted to know exactly what you wanted to do and you had your game plan. And then there's students that are like, I'm not exactly sure. How do I actually get from A to Z? And what about if my plan changes? So number one is just talking about you, talking about what you want to do academically. Your goals are going to be different than your classmate or your friend's goals. So we have these individual conversations. Additionally, if we have so many certificates and degrees, it's not your job to know everything about them. What we need to know is which one or two are you interested in, and then the academic advisor can meet with you and speak to you about those programs. We'll walk you through the curriculum, we'll walk you through your own plan, which I'll get into a little bit more. And we actually create an academic map. So it's called MAP for my academic plan, but it's not mine, it's yours. And we will actually show you on a system semester. So like if a student started this fall, they would have a list of classes for fall of 2020, a list for spring 2021, summer, and so forth. So we actually lay out a physical plan that you keep and have electronically, so you can always kind of revisit that once you need to register. If you have to change your plan, students sometimes will say, I think I need to take the summer off, or I need to skip a semester, or I've realized I got a new job and I would really like to take less or more credits now that I know what I'm responsible for. So we build that map in the beginning, but it's not set in stone. So students are actually able to come and see us to adjust it as they need, as things just happen in people's lives. And we also help with registration, especially now in a more virtual world. We walk through students on how to register for classes. If necessary, drop one and pick up a different section if it wasn't the correct one they wanted. And we talk about really important academic deadlines. When should I be enrolling in classes? When should I consider, if I think I'm going to take this many, if I decide not to, when is that the time? So we look at all the deadlines that the actual college has, and we talk to the students about what's best for them. And Liz, I will say that the question that you asked earlier, we do discuss college credit taken at the high school level. That includes college credit plus classes, also tech prep proficiency credit, as well as if they took credit at a college, not as a CCP student, but on their own and have this credit. So we look at everything the student has done in their course of their high school career, if it was college credit, to see how that is equivalent to Sinclair's credit, because we would never want you to repeat a class if you don't have to. And I say that fully because I wouldn't want to have to either. And so we want to make sure that you're on track with what you've actually earned in your high school career, and also complement that with your map for what you need to take at Sinclair to be able to give a full view of what your goals and plans are in your timeline. So, oh, and I will say, academic advisors, our jobs stay the same, but your needs change. So what you need on day one I meet you may be completely different than 2 semesters in. So we evolve based on your needs, and we help you based on what you ask us, or what we think you need to ask us, but you're not sure about that either. So just so you know, because you're matched with an advisor the entire time, we'll help you during that, that full journey. Okay, so I've talked a lot about my role as an academic advisor and my team, but now I want to talk about your role as a student. And I cannot tell you enough how I encourage students to come prepared. And I put quotes on it because this is not a test. It's really just making the time to come and see us. Students get so excited about going to college, sometimes they forget to see their advisor. And they want to come and see our advisor because we have so much wonderful information to tell you about the program that you're studying, and to make sure that all your ducks are in the row so that you can start in classes in August or in January, depending when you begin, to make sure that you're on track. And with all that excitement, sometimes it's easy to forget something. So we're your guide to make sure that you're not forgetting these items and that the important items and steps are completed. We also want you to actively participate with us. I can tell you, when I'm in an advising meeting and I'm trying to get someone to talk with me, it's because I really want to hear what your interests are, what your goals are, what your skills are. Did you complete college credit? What was your experience in high school? What are you nervous about? What can I help you with? But until I hear from you, unfortunately, I can't read minds. So I ask all these questions so you can come to us and we can have these conversations. Additionally, is just being honest. Sometimes I have students come into my office and they say, I know exactly what I would like to do. This is how I'd like to do it, but I also don't like this. And I like hearing what you may not like, because then that also tells me at some point, if you had to take a math class and you don't really want to, our degrees require it, when you get to that point, should we have a discussion of how you're going to overcome your nervousness with math and be successful in the class to move forward? So it's really up to you how much of a role you want to take, but all the advisors really appreciate the honest feedback and information about yourself because we want to help you. So finding your own path. So if you have classmates, or if you're twittering to each other or talking to each other about this presentation, know that when I see each of you, it's completely different. The curriculum might stay the same because it is. If nursing students have to take these classes, or medical assisting has to take these classes, but your entire path of getting to where you want to be is going to be individualized based on what you tell us. So some students will say, I would like to go to school full-time. Other students will say, I would like to go part-time, and that's dependent on their personal schedule. Do you have a part-time job that you have to fit in, volunteer work, or you have other personal obligations that you're like, I've been in high school for so long, I don't want to go full-time. And that's an okay decision if that's what you know about yourself. Additionally, as mentioned before, do you want to do a certificate before you actually decide on your degree? That would then give you more experience in the healthcare world ahead of time. So then you can easily say, I can totally see myself envisioned as this, versus I think I want to do this, and you get your feet wet and you're not sure. Maybe a certificate is the building block that you need to make that choice and to jump full force into it. And also finances. Financial aid, federal loans, or federal grants, a lot of students assume that I have to be full-time to take classes to get financial aid. That's not necessarily fully true. Depending on what your financial aid package is, we would be able to talk individually about what your aid package looks like once it's fully processed to see if it matches what you want to do to move forward with your classes and your schedule. Selecting a program. So each program has its own set of curriculum, and each program has an admissions process or prerequisites for certain programs. So we want to go over them individually with you. I get a lot of questions during presentations just asking, what does this program do versus what this program does? We're going to go over a general overview, but I really would love to see all of you talk with us or look at our health science website to get more in-depth information, and then actually come and speak with us about your goals so we can go over that information specifically for you. Because some of you might have tech prep or CCP credit, others may not. And so that's why it's an individual conversation about the program itself, as well as where your path is going with it. And as I mentioned, some students might do that certificate ahead of time, one for employment, healthcare professional experiences, to get a full-time job with benefits and healthcare, to be able to then actually go forth with getting the degree and getting that tuition assistance, which is very helpful, as you know, no one really wants college debt. And then we build that map with you.
Jenny, can I just kind of ask you to make a point there real quickly? I heard you say something about students that might be coming from a career tech program and students that are not. With the prevalence of our many career tech programs in the area, I know a lot of students might be coming with some background, but what about that student that's sitting out there saying, you know, I didn't know that I wanted to do this until right now, and I'm a senior. You know, they're still able to join these programs, right?
Yes, it's never too late. And I say that because, yes, our audience today, all of you are in high school, or there might be some middle school students there, but we have adult learners that have been working in a completely different field outside of healthcare, and 10 years or 20 years later outside of high school, they come back to see us. So truly, it's never too late to start. It's just deciding on when it's good for you to begin. So great question. With the admissions requirements, I wanted to highlight just some of the general ones. So each program, Vet Tech is different than nursing, nursing is different than OTA, OTA is different than PTA, but some of the classes or prerequisites overlap. So this is why it's important, once you have an idea of which program you want to pursue, your academic advisor will go over those specific prerequisites. Normally that includes courses, a certain number of courses, a certain grade in all the courses, so C or higher, a GPA requirement. So for example, if there's a GPA requirement of a 2.5 and you have to take 5 classes to get those prerequisites done, I always tell students sprinkle in more B's and A's in there to get there. And we also have a pre-admission exam. And I say this because it's not to intimidate students, because in high school, I know you guys are all so tested out. And because of that reason, the TEAS test of essential academic skills, is a test that you will need to take, but it's not something you have to take the moment you walk on foot to campus or take your first online class. It is not that whatsoever. But we have certain resources and study guides, which was actually created by the health sciences and Sinclair faculty to help with the TEAS, so that you're well prepared. I was lucky enough, Dr. Shuchat actually gave advisors that were being onboarding a few years ago the opportunity to take the TEAS. So I literally tell students my experience of walking into the testing center, and this is what I had to do. And we talk about it. We talk about everything you do before you do it if you come and speak with us, because we want to make sure that you're well prepared and you know what you're doing so that you stay on track. And even if your track changes, that's okay too. We're able to take a detour with you. Okay. And the biggest thing is, even though you meet with us in the very beginning for advising, I recommend seeing us every single semester, even if it's been smooth sailing, just as a touch base. What are your time commitments? And my high school math teacher husband that I had was very proud of this because they made it to 100%. But I talk to students, you know, in 24 hours in a day and 7 days a week, what do you envision your schooling to be in that time? Is it 50% of your commitment is going to be college? Is it going to be work? Is it also going to be personal obligations that you have? And this is where the honesty and being upfront of what you're trying to commit to, because we advise you, we provide you with recommendations, and then you as the student have to decide what's best for you based on your situation. And so we walk you through these different scenarios. And for this student, it's pretty well managed because it's 50%, 30, and 20. Some students might have to work more, or some students might be full-time for classes. And so we want to make sure that you're being realistic with the type of goals you're setting so that you stay on track with courses and maybe not have to repeat courses because maybe you didn't know that you had to work more. So we have these conversations early because we want to make you sure that you're taking under these items under consideration. Resources. So we're not, again, throwing you to the wolves and saying, here's your map, you're registered, go do it, I'll see you next semester. We make sure that you have resources on campus. And Sinclair is so well versed at making sure students know these are available. And in such a virtual world that we're in, have transitioned to meet students where they're at virtually. And we want to make sure that even though you may not know these resources exist, if you ask your academic advisor, you then would be able to talk with us. We see a need and we say, have you spoken to our Biosis Lab? Have you decided to do maybe a Zoom meeting for that? Because the Biosis Lab, 1, connects you to a tutor, 2, connects you to other students who are possibly in your class in a virtual area that you can actually speak to other people. And so it gives you a leg up when you're actually taking a course. And I talk to students all the time. It's very common, actually, I think, in high school to college, that people assume tutoring is only if I'm not doing well. Tutoring, writing lab, Biosis Lab, getting that leg up is basically working efficiently with your time. And if you don't have as much time because you are working, or you know that you're not consistently in class Monday through Friday because college, you only have class Tuesday and Thursday, and you want to have someone to go over the information with you, tutoring is really important to stay on top of your work and also to build confidence that you know what you're talking about after you've left lecture. So I really talk about students, the resources that we have there. And so what now? You have all this information. You know, Sinclair has a lot, you're shopping around. I would say explore your interest. Start researching the careers that you're most interested in. Do some career assessments if you're not sure. And also don't count something out until you actually look through even our websites to see whether or not that is something you would like to do. Go to the Health Sciences Division website because it has all the curriculum as well as the courses and the degrees and the programs. And then once you go through that information and narrow it down, and when I say narrow it down, usually students are interested in healthcare. I say pick maybe 2 or 3 to begin with and come and speak with us, because at least we can tell you more about the admissions requirements, or if there's less because it's a certificate, what's the timeline to get these done? And we want to make sure that you're looking at all angles to make the decision that's best for you in advising. Right now, our admissions department is actually holding virtual tours for students, as well as one-on-one appointments. They'll kind of help you, direct you to see an academic advisor and get you scheduled with us, as well as other things that you might need to start with. Like if you haven't actually applied to Sinclair, do you want to do that right away? And they walk you through those steps as well. And the easiest way to actually get a hold of us is this page. You can actually email us. Email is quick, but also the phone. I know people, I'm old fashioned. I like calling people, but please feel free to take a photo or screenshot of this, and then you can keep it for your records as well. And I'm happy to take any questions. that might have covered some of them too.
No, that's wonderful. There are a couple questions here that I'd like to make sure that we do address. So we had one from Kiera, who's a 9th grader at Dunbar, and she's interested in a job in healthcare and was wondering how important is school for her right now? So as a 9th grader, how important is school for getting her on one of these pathways?
When she says school, there's a couple things I'm thinking of, whether it's high school or college. And so
I think she's meaning her high school right now.
Her high school. Well, I will say this, high school well prepares you to take on these programs. So focusing and making sure that you get your basics down at the high school level will help you in the future as well.
Good.
And high school also, since she's only in 9th grade, if she eventually decides to do CCP College Credit Plus in her higher level grades, junior and senior, you could knock out some classes, or if you join a career tech school, that's also an option for you to get experience. So think about that from 9th grade.
Awesome, that's great. I don't actually have the parent's name for this one, but we had a question that was asked of a lot of our health professionals this week. How has COVID impacted what you all are doing out there at Sinclair?
Well, it's kept us on our toes. This is, again, why our relationships with our clinical partners is so important. Back in March and April, when all of this started and it was unknown, we had to have honest conversations if students should be continuing in their clinicals and continuing their study. I worked very closely with the college president, and I said, not only is it important that these students continue their education for their own livelihood, our region needs these frontline workers, and we have a responsibility to our partners to let them graduate. So Sinclair Health Sciences has been continuing face-to-face where we have to since March. We haven't stopped through the summer and continuing now. You will see us on campus. All of our lectures had to go remote because we want people at school as little as possible. We have them come to school for labs, but they are actually wearing hospital level PPE in the labs, which would not be normal practice, but that's to keep them safe within each other and keep our faculty safe. And then they're continuing to go to their clinicals because our clinical partners say, we support them coming and we need those future employees. So it has been exhausting. It has been a new dynamic, but it makes us realize how important our programs are more so.
And from the student services sides, academic advising, placement testing, our integrated student services, financial aid, we are all very, very accessible virtually. I can't tell you, for academic advising specifically, we have phone and virtual appointments. I highly recommend if you meet with an advisor, do a virtual appointment, because I could share my screen just like I did the presentation and show you everything I would in the comforts of your home, and you can wear pajamas. But it's just a good way to know that we are here. I think Sinclair did a tremendous job of getting up and running in March when we were pretty much told that we couldn't be there, and we were accessible to our students and very pleasantly surprised the students that we were here for them. We just weren't in our offices. So we've made homes in our offices here, and we will see any of you and talk to you about all this together.
Well, we are reaching the end of our hour together. It has really flown by. There's so much amazing information that you were both able to share. So thank you both Jenny and Rena for joining us this morning. You provided us with so much information about what Sinclair has to offer. And I know I'm excited about so many of these programs, and I hope that the students that are watching are as well. One last reminder that I want to make to all the students out there, please make sure that you follow up and check out Sinclair Community College's website so that you can learn more about these health science departments and certificates and programs, and reach out to one of the academic advisors. And also, this is the last of our live events for Health Professions Week, but everything will be cataloged, the hands-on activities, all of the videos on our Health Professions Week website, which again is DaytonRegionalSTEMCenter.org/HPW. And lastly, I just want to also mention a reminder, both Jenny and Rena mentioned that there are CTC programs in the area, and we actually have information on our website about the Miami Valley CTC open houses that are coming up in December. So go to our website and check that out, in addition to all of the Sinclair programs and all of the other offerings that we've had. But thank you both so much for being here today. It was a pleasure hearing from you, and we hope that many of our students take you up on these offers to learn more about your programs. Thank you very much.
Thank you for having us.
Thank you.
Thanks.